Hey Facebook, welcome. It's Facebook Friday. We're a little late to the game today due to Julie's patient load, but I'm super excited. And it's funny because what we're talking about, I'm slowly sliding and I might fall because of my shoes. But this poster right here kind of says it all. Is the volume loss in your cheeks making you look older? And that's what we're going to address today. And I'm going to stand up now because I was squatting for you guys. That's what we're going to address today is volume loss in your cheeks and what you can do and what we can do to help you with that. So today our injector Julie is here. Hi, Julie.
Hey.
And our patient Colleen.
Hey.
You might recognize Colleen. She's one of the cosmetic coordinators. So if you're interested in surgery, you can speak to Colleen. Now, one thing that's concerning to Colleen is she's losing some volume in her cheeks. Is that correct, Colleen?
Yes.
Okay, so today we're going to use a product called Juvederm Voluma. And Juvederm Voluma is FDA approved for cheek volume. Am I doing your spiel for you, Julie?
Yeah, but go ahead. Continue. You're doing a great job. You know it all.
All right, so what you're doing now is you're cleaning her off her makeup a little bit.
Yes.
We're not totally going to take all her makeup off, but you know where she's going to probably inject. She's going to take some makeup off. And then we're going to go ahead and assess where Colleen is looking to give a little bit more volume back. And then we're going to inject and then go from there. All right, so one thing about Voluma, and I'm going to go back to this chart real quick here, is you can tell here that Voluma gives you more of a round, like an apple in your cheeks. So flat and sunken, that can make you look older. It can also sometimes cause your nasolabial folds to deepen. Which can, a lot of people are like, oh, my nasolabial folds, I want to fill them. Well, not necessarily. Sometimes you need some volume in your cheek to help bring that back up because you're like gravity. What does everything do? It goes south. So this is going to help volumize that. And again, here is some more before and afters, but of course we're going to show you. And it does last up to 2 years, and it is FDA cleared or approved for volume loss in your cheeks, and it's the only product I believe I know that's FDA cleared for this. So Julie, here we go. So Julie, let's first assess the patient. Let's see what she's interested in. I knew we did this prior, but
Yeah. So Colleen is feeling like she has a little bit of volume loss right in this area, and just a little bit in this area as well. Colleen has beautiful high cheekbones. She's a very easy canvas for me. I am just going to inject small amounts right on top of her cheekbone, and just to give a little bit of contouring and a little bit just of shaping and lift.
Now, one thing I know you said earlier is you tend to kind of do a little bit, assess, a little bit assess. You don't overfill at first.
Yeah, there's a lot of stopping and starting with cheek injections.
And it's kind of a difficult procedure to do. You have to kind of be an artist for cheek injections. You have to kind of see the contour of it.
Yeah, you have to have an eye for it for sure. And it does, like I said, Colleen is an easy, she's going to be easy because she has this beautiful canvas for me to inject.
Now, one thing I was talking about earlier with this before and after is a lot of times patients come in, and Colleen, sorry, you don't look like this, but they come more sunken in.
Right.
And they want to address this, but really they sometimes just need more of a lift.
Yes, exactly. Yeah, and so in that case, we would have to use probably a little more than, I'm just using 1 syringe on Colleen today. Average, I would use 1 to 3 syringes. I have used 4 syringes on a patient before when I really have to build a cheek from scratch if they have a lot of flattening, a lot of volume deficit. But yeah, in that case, when I do use more syringes, I can get some pull and a little bit of lift.
Perfect.
Some tightening. Yeah.
Okay, so we're going to go ahead and inject, and then during the injection, we're going to talk about post care, and then Julie has an announcement we're going to be making after this. No pressure. And for those that are just jumping on, we're doing, if you've volume loss and sunken, flattened cheeks does make you look older. So this is why we inject Juvederm Voluma, which is FDA cleared for cheeks.
We didn't get a picture.
Oh, rats. Oh, no, we don't have iPad in here.
iPad in here.
Oh, well.
Okay.
Sorry.
Next time. All right. So turn this way just a little bit, and I'm going to start right here where she has the most volume deficit. And you let me know if you need to break it all, okay?
Now, Julie, does this have lidocaine in it?
This has lidocaine in it, so I always ask the patient if they have any lidocaine allergies or sensitivities. And this is, it's a pretty deep injection. It has to be laid right on top of the bone. So just putting in small amounts. There is a little bit of bleeding typically with this injection because it is so deep.
Colleen does it like a pro.
Yeah. I always aspirate to make sure I'm not in a vein. Back here can be a bit more tender. You doing okay?
Mm-hmm.
Okay.
Great, Colleen. I like your eyeshadow
Mm-hmm.
today. It's great on camera.
Colleen's just pretty.
Yes, she is.
Thank you.
Alright, that there.
Now, I forgot my question. If you guys have questions, comment. Julie and I will answer them throughout the feed. I had actually a pretty good comment. I forgot. Will she swell from these injections?
You can swell a little bit. Typically, I mean, when I just use one syringe, there's not a ton of swelling involved.
Mm-hmm.
If I were doing four syringes, then she could have more swelling. Bruising is also something that can accompany any injection, but definitely cheek injections. Some people don't get any bruising at all, and some people can get a lot of bruisings. Just depends person to person.
And what you're taking. If you take an Advil or fish oils, that can all make a difference too.
Yeah.
And she's just looking to give her a little volume in her cheeks because she does feel a little flattened. Which happens.
See, already right there.
Mm-hmm.
It's so pretty. It just gave some nice contouring. Sit up for just a second.
Oh yeah.
Okay, go ahead and lean back.
And Julie, why do you feel that patients lose volume? Could it be from weight loss?
Weight loss, age, just loss of collagen. With age, we lose collagen. And collagen gives us that fullness.
You know, age just really goes down south for
I
everything.
know.
I'm telling you. It's from the hairline down.
Mm-hmm.
Sometimes the hair, too.
Yeah.
And bleeding is normal.
Yep.
Mm-hmm.
And this is just a little bit of bleeding.
Yeah, it's nothing.
It's not a lot. So I'm just going to hold that there for a minute longer.
Now, what are some pre-care? I mean, possibly no Advil for 24 hours.
Yeah, no
What's
drinking. If you can stop drinking alcohol, like honestly, a couple of days before, because alcohol can thin the blood a little bit, which can increase your risk for bruising. Yeah, no Advil, ibuprofen, aspirin, Excedrin, fish oil. All those things can cause blood thinning.
Okay.
Okay.
Perfect.
All right. I like that. I'm going to move on to the other side.
So this is very normal. Our injectors move from side to side because they want to take a look and have the best angle. And again, you're going all the way down to the bone with this injection, correct?
I am.
Now, Juvederm Voluma is $8.50 per syringe. So it is our one of our higher priced fillers, and that's because of the thickness it is. It lasts for over 2 years, so that's another reason why too. It will be on sale at Spring Fling for those who are interested on May 16th. And I think fillers start off. I'm gonna maybe give you guys a hint if you're watching. Fillers start off at 20%. Start off. That's a little hint. They might go up from there. Oh wait, do it again, Julie.
20% is pretty awesome when it's
I know.
$8.50 a syringe.
I know, but it also goes up
Nice
from
little
there.
discount.
And the nice thing about, you know, the Center PC is because we do have the best of the best injectors here. We definitely give them the highest training they can possibly get. And, you know, we're able to offer the best discounts in the area. I mean, honestly, the Spring Fling, I mean, there's tons of other places you could go to, great facilities, but we are able to offer you the best pricing. And, you know, sometimes people say to us, you know, you're a little high. Well, we understand that. That's because our injectors have certain levels of training that they have to go through and certain certificates that they achieve. There's different types of injector courses that they attend. And, you know, that's why we tend to be a little more, because we do have more training than other facilities. However, you know, that's why we are able to do Spring Fling, to offer, you know, those large, deep discounts for you guys. And they will by far be the best discounts in the area. I can tell you that. At Spring Fling, discounts range anywhere from 10 to 50% off. Yeah, someone just did a like when I said that.
All right, I'm gonna get a little closer here. Doing okay.
Mm-hmm.
Just about done, actually.
Mm-hmm. You, we can do a topical numbing. Is that correct, Julie?
Mm-hmm.
If you would rather,
Yeah.
if you'd like to, if you feel that your pain tolerance isn't as high as Colleen's.
It's really not that bad.
Looks good. So far, you've only used like a half a syringe so far, right, Julie?
I have. Colleen just really needed a little tweaking. She
Mm-hmm.
didn't need anything major. I didn't have to like build a cheek on her. I actually want to clean her off, switch sides again, and clean her off so I can see better.
Mm-hmm.
We may be close to being finished.
How do you feel? Good?
Feel good.
Okay. Just checking on you. Now, I feel like, you know, to me, cheek filler really isn't a lunchtime procedure. It does take a little bit longer than our other fillers, so keep that in mind. And, you know, you want Julie, Michelle, or Amy to take their time with you when it comes to cheek filler. So don't, you know, when you come in, you know, don't feel, I hope, you know, take some time out to make sure, because they want to get it right for you, as well as make sure you're happy when you're leaving.
Okay, sit down for just a second. Looks pretty even.
Mm-hmm.
Okay, so Colleen, take a look and let me know if there's any area where you feel like you definitely need just a little bit more, want a little more contouring.
Oh, I think it looks good.
Okay, yeah, I think we're good. It looks nice and even.
Mm-hmm.
We just created a little bit of a sharper contour is all, and it looks very, very natural.
Yeah, it does. Looks like you had nothing done, Colleen. I won't tell if you do. All right, so Julie, post care. What's in post care for this type of filler?
Yeah, so post care, I'm gonna send her home with a few little ice packs. I just want her to ice it on and off throughout the day. That can help with the swelling and bruising. And then we always like to put a little bit of our Center PC vitamin K lotion on our patients, because that as well can help with reduce the risk of bruising. That's it.
Other than that,
Yeah.
pretty cool. All right, so Julie, you have an announcement. Do you want me to make it, or do you want to make it?
Oh, I'm moving to Texas.
Ah.
So my family's relocating, so my last day here is May 10th. So
But we have a new injector.
we have a new injector, Amy. I've watched her inject. She is stellar. She's wonderful. She's beautiful. You guys, I'm leaving you in really good hands. And you all know Michelle is fantastic too, but
Yes.
Amy is going to be so great.
So we're gonna miss Julie a lot, and we're really sad she's leaving, but we're happy for her and her move to Texas.
Thank you.
You're gonna be now a Texan.
I know. When do I get to call myself a Texan?
I know.
How long do I have to live there?
I don't know.
I don't know.
Did you
Find out that
have you got
rule.
any cowboy boots yet?
No.
That might be your next
It's like
purchase.
top priority.
I know, you
Yeah.
get in a little hat.
Yeah,
Let's
I don't know
see.
what the hat boots.
Yeehaw.
Yeah.
All right, so we're really sad to miss. We're gonna miss Julie a lot.
Go. I'm gonna miss this
But I'm
place.
so happy that she has helped handpick Amy. Someone said yes, yeehaw.
Oh, nice.
But she's helped handpick Amy to take her position and oversee her patients. And Amy is fantastic, but so is Michelle. So one more look at Colleen, and then we're gonna talk spring fling. It looks really good, Colleen. And you're gonna be happy.
So good.
Big Kratzik and Colleen.
Yeah.
She just got married.
Yeah.
All right, you guys, so that's it for Facebook Friday. We have a couple weeks until Spring Fling, so if you haven't gotten your RSVP in, make sure you do that. Again, we're going to have amazing door prizes, wine, champagne bar. We're going to have hair touch-ups, makeup touches. It's just a lot of education. We're going to be on stage every 15 to 30 minutes with a different procedure. So it's going to be a lot of fun. We hope you come out to Spring Fling on May 16th. We do have a giveaway currently on our page, so make sure you go there and like and subscribe to us on our Instagram, Twitter, Snapchat, and Facebook. Have a great day, guys.